Hi, my name is Dr. Nicholas Trameri. I'm a physical therapist at Full Potential Physical Therapy, and I'm here today to talk about knees and knee health. Now, knees are a very common location of pain in the body. When we look at our knees, there are two main forces that they undergo with movement and activity. Those two forces are called shear forces and compressive forces. Shear forces involve how much the bones in our knee, which is made up of our femur and then our tibia here, want to slide over each other in opposite directions. So when we are running, changing directions, twisting, bending, all those movements incorporate shear forces where either our femur wants to move more forward this way, or our femur wants to move more forward this way, while the tibia is moving in the opposite direction. The other type of force is called compressive forces. That one's a little bit more self-explanatory in the sense of pressure from two parts of the bone pushing on each other. This happens every time we take a step, anytime we jump and land. The greater these forces, the greater the compression is in those areas. This happens typically between the femur and the meniscus and the tibia here as we are weight bearing and pushing down in this way. Another way this also happens is along the back side of the patella or the kneecap and the femur here, because as we move and bend our knee, that patella tracks along the bone of the femur here. Now, when it comes to these two forces, and really any force within the human body, our body works on a currency system of stress and load. When we consistently overload into that system with these forces, injuries, pain, irritation, all can occur. Now, vice versa, if we consistently underload into these areas by not changing directions, by not walking or landing or using those body parts, specifically today talking about the knees, then our knees can also become stiff, weak, and overall just less resilient to activity and motion. In general, we are looking for a just right amount of activity and loading with these forces. I like to use the term a Goldilocks zone of not too much, but also not too little loading to promote positive adaptations to our body's ability to handle this load and this stress. Now, exercise and movement are helpful and positive for our knees. Doing a deep squat is not inherently bad for the knees. Jumping or landing or kneeling on our knees are also not bad for them. It's just a matter of how much our body is able to handle and tolerate when it comes to these different stressors. Dosing and progression matters significantly when it comes to these types of activities, especially as we get into higher level motions and movements such as jumping, landing, quick directional changes. If you are experiencing pain or problems with your knees, feel free to reach out and give us a call here at Full Potential. We would love to help you return back to any activity that you are wanting to.